Hi everybody. I have not posted a video in 2 years and I've had so much stuff going on. I think sometimes I get a little depressed having this condition, so I don't make videos. I try not to focus too much on it just because I feel like if you spend every single day worrying, which we all do, because there isn't a day that goes by that I don't think about this condition, because pretty much every day I have to take medication randomly. But if I try not to focus all of my energy, sorry, I'm yawning, I'm so tired, it's like 11 o'clock. I try not to focus all my energy into the condition, but I did want to share my story. I saw a lot of people ask about pregnancy and sphincter of Oddi dysfunction. Not a lot of people have been pregnant and had sphincter of Oddi dysfunction. This is my third baby, but my first baby with SOD, and I wanted to tell my story. So here's my little baby, little Leo. He was born on May 7th. And I wanted to share my story, so I will tell you what happened. So I got pregnant. It was a planned pregnancy. Nobody really told me not to get pregnant or that I have any complications, so I decided to have my third baby. I had heard that SOD goes away with pregnancy, so I was kind of hoping the same thing happened for me. My doctor knew my history with liver failure, functional liver failure from sphincter of Oddi dysfunction, pancreatitis from my sphincterotomy. She knew all that stuff. So they automatically put me in with a high-risk doctor. So the high-risk doctor was monitoring me closely throughout my pregnancy. They were also watching me because my baby developed a voluntous cord insertion, also known as a VCI. It's something rare that happens where the umbilical cord, instead of implanting into the center of the placenta, it attached to the side. So instead of it being kind of like a cord that's wrapped like this and like plugged in to a light socket, his was like all of the arteries and veins were spread out like this, and it was attached down to the side, which no matter what, it all has to get up into the little socket. That's how I describe it. So it just looked like a bunch of spidery veins that were all exposed, and usually there's this stuff called Wharton's jelly that protects the end of the umbilical cord so that there's not a rupture or other little different things that can happen with it being exposed. The baby getting big, pushing on it, cutting off the supply. It was exposed, so I was at higher risk for complications. I was also at higher risk for bleeding, like postpartum hemorrhage, stuff like that. So they were watching me close, really close. Everything was going. I had found a new sphincter of Oddi dysfunction doctor to follow my care in Greenville, North Carolina. His name is Dr. Philip Goldstein, and I recommend him to everybody and anybody. All of his nurse practitioners, everybody there, 100% believe in sphincter of Oddi dysfunction, and not only do they believe in it, he knows how to treat it. And I actually found him from another girl who has sphincter of Oddi dysfunction. He sent her for an open transduodenal sphincteroplasty at Duke University, and she, I believe, is cured. If not cured, at a very manageable state where she's living happily, which is good. So my pregnancy, I gained a lot of weight. Again, I gain weight every time, but I gained a lot of weight. The baby started causing, around the second trimester, I was having a lot of uncomfortable pain in my upper right side, just from pressure. Where I had the sphincterotomy, I'm sensitive a lot, I've noticed, to different things, foods, just different things make it sensitive. But I was having daily annoying aches, not pain, nothing severe, sorry. But it was just annoying. So he wanted me to be delivered between 35 and 36 weeks because of the amount of fluid retention I had, and then I was uncomfortable. But not only that, he wanted me to go back and have another sphincterotomy at the end, because he said sometimes the doctors will cut the sphincter, but they don't cut it far enough, so then you have like partial spasms, which is what I was suffering from after my first sphincterotomy. I was having partial spasms that I continue to control with hyoscycosamine. He thinks if I get it cut again further, that it will control, or it'll completely get rid of my sphincter of Oddi dysfunction. Oh my God, I'm so sorry. Riley, stop. So, my dog freaks me out. So he thinks that it'll get rid of it completely, which, my God, if that happened, I would be so freaking happy. I highly doubt that would happen, but I really, gosh, if that could happen, I would be really happy. I'm too scared to have another sphincterotomy because I was extremely sick after the first one. Ugh, I don't have the time to be sick. So, I have not had another one. Anyways, into the pregnancy. Sorry, I get distracted sometimes. About the third trimester, everything went away. All my pain went away. I felt the best I've ever felt. That's probably why I got so fat, because I ate everything and anything I wanted while I could enjoy it. Because when I'm not pregnant, I do not get to enjoy food at all. I can't enjoy anything. So I loved the food while I was pregnant. So around 35 weeks, they decided, my OBGYN, my high-risk doctor, they didn't want to deliver me. It was the biggest pain in the ass. Sorry, the ASS word. They did not want to deliver me. I was really mad because I was extremely uncomfortable with this pain. Only my SOD doctor knew what I was dealing with. And the nausea. I had nausea. They would not deliver me at 35, 36 weeks willingly. Now, what did happen, right after I got released from my high-risk doctor, my baby quit moving. And I want to say one thing: if your baby ever feels like he's not moving as much, you need to call your doctor. It is not true that as a baby gets bigger, you feel them move less. That is actually very false. They should be moving the same amount. If you feel a decrease at all, you need to contact your doctor, and they need to monitor you. There's different things that they can do. Like with my baby, they did a BPP, which is actually different than an NST. It's an ultrasound where they can actually look at the baby and they monitor their movements. They give them a score, and depending on what that score is, you may have to be delivered. And in my case with my baby, I was supposed to have my appointment on a Friday. I contacted them on a Tuesday. They got me in on Wednesday. I should have actually went in on Tuesday. They did an ultrasound. They looked at him, and he was not doing well at all. The only thing he had was a heartbeat. And I'm assuming this is because of the velominous cord insertion, where he was, I think something tore in me. They kept asking me if anybody said something about the lining. I don't even know. I can't even remember all of it, but they were acting weird. My ultrasounds were usually 10 minutes, and it turned into an hour, and then the doctor came in the room, and they sent me straight over to the hospital. Because of my sphincter of Oddi dysfunction, liver issues, pancreatic issues, they could not do a C-section, because C-section can actually increase your risk of pancreatitis. I think any abdominal surgery can. So they were really trying to avoid that. They didn't want me to have any more complications that could cause, significant issues for myself. So we completely avoided the C-section, and they induced me, and I had a vaginal delivery. So with medications and the delivery, they kept my hyoscycosamine on standby. They talked to my GI doctor. he said I could have a fentanyl epidural. So I did have the fentanyl epidural. It did not affect me. I did not have any type of a spasm. I was completely fine. I had my baby. They wouldn't give me anything stronger than Tylenol, so I would recommend 1,000 milligrams of Tylenol if you're gonna have a baby, because those after contraction-y cramps when your uterus is shrinking, my God, that was awful. In its own, for my third baby, I was in so much pain. Nobody talks about that. I don't know why people don't talk about the contraction pain you have after you have the baby. I always went in and saw people after they had their babies and they're sitting there fine, I guess because they had drugs, but I had no drugs and I was in so much pain after having him. I had to stay in the hospital for 5 days because I ended up hemorrhaging. The baby was a month early, so he had some blood sugar issues that had to be addressed, and jaundice, and I was in so much pain. For 3 days, I was begging for heating pads. I'm pretty sure I took every single heating pad in that building. With COVID, they were running out of heating pads for some reason. Speaking of COVID, no, I did not have to deliver with a mask on my face. Actually, it was kind of the same as when I had my other babies, except I couldn't have visitors and he wasn't allowed to leave the hospital. So, and then we didn't have a lot of people in and out of our room. That was about it. And they didn't come in. They didn't monitor us as much, which was kind of nice. I got a little more rest. But other than that, it was very similar to what I had ever experienced before. And then around 2 weeks after having the baby, I went home and I started to have spasms again. Not big spasms. I haven't had a big attack since August 24th, 2018. I've controlled them after my sphincterotomy with hyoscycosamine. And I do want to say I had my sphincterotomy in 2017. 7 months later, I had my next big attack after my sphincterotomy, but then they gave me hyoscycosamine, and the hyoscycosamine, if I take it, as soon as I start to feel the discomfort, then it completely stops it. Now, after having my baby, I was having periods, like around my period for some reason. I've noticed I'm having more spasms like around the time where I have my period. I don't know why. I've heard of other people having that issue. I didn't have that issue before I got pregnant, but now that I had the baby, I do have that issue. And so about once a month, I can expect some uncomfortable spasms. I'm kind of sick for about 4 to 5 days. It can be nausea, random spasm pain. I don't work because of my condition. I am a full-time stay-at-home mom because I'm sick once a month. I'm sick for a week, and there are not a lot of employers who want to deal with that. I am actually starting something different now, working for a financial firm with my neighbor, but from home. So I am going to be working, but just from home, where I'm able to manage my condition if something happens. So I'm not like sick. I don't want people to think that I'm dying. I'm not dying sick or like in severe pain anymore, but I have spasms, and the spasms are uncomfortable. Like, it requires me to be able to lay down. I have to rest. I've noticed a lot. Meditation does help. If I get stressed, that will bring on spasms. One thing that's different that Dr. Goldstein gave me is baclofen. So if I have a really bad time, like where you get that sharp stabby pain in the right side and it just won't go away, it just feels like you always have this annoying pain, I take the baclofen and the hyoscycosamine, and I can get it to completely go away now to where I have nothing and I'm fine for a couple of weeks. It's annoying because it always comes back. It doesn't ever just go away. I did go see another doctor after I had the baby. Dr. Goldstein referred me to another endoscopist to have the cut further extended, and he would not do a second cut because of my history of pancreatitis. He told me no way, that I'll be way sick. He told me I'm better off dealing with the pain, which we all know that's not true. I'm telling you now, if I go back to having severe attacks, I am not gonna just sit around and deal with that pain, because you can't. You can't even live. Like, you can't take care of anything. Your house, anything that you need to take care of, you can't, because you're in so much pain. Thankfully, I have people to help me whenever I have like those moments where I'm in a lot of pain or whatever, but and I'm so sorry, I'm tired. But there's no way. You can't live like that. Doctors just don't, Dr. Goldstein understands. Other doctors, they don't understand. They don't, I mean, even looking at someone in so much pain, I don't know how you can call them a drug seeker when they're in that much pain. I mean, I have been on my hands and knees, vomiting my guts out, screaming, all like, I just sound like a psycho. I'm like, oh my God, oh my God, oh my God, help me, because you're just in so much pain, you don't care if people hear you, because it's like you're stuck in a box and people are stabbing you and you can't get out and there's no help. And it is the worst pain I ever felt in my whole life. And whatever, I've already said that 1,000 times. But anyways, my baby is here. He is healthy. The hyoscycosamine is a class C category, not tested like on women who have been pregnant and stuff, but I have to have it. I cannot not have it. So for the first month and a half to 2 months, when I was still having spasms, I did use hyoscycosamine, and he did develop a pretty large, it grows daily, it's a hemangioma. I don't know if the medication caused that or not. He also has a really large stork bite. Both of those are considered birthmarks, they said. But they should go away by the time he's 2, I think. But I think my medication caused those, but I don't know. Some kids just have them, and their parents never take that. I'm so sorry. I'm probably making everybody tired just watching my videos. But anyways, I guess I'm going to get off here so I can go to bed. I will be posting more videos to try to keep up with people again and share more information. So comment on my video, ask me questions, share it with people so that we can get more people to know about this condition and to realize that it's real and normal. People who are not drug seekers do have this condition. So if you could share this, and I will talk to you guys later. Have a good night. Bye.